Good morning. It is Friday, November 14th, and once again, we have a lot to cover. So I'm going to begin today by just highlighting a podcast interview that was released this week. And the reason I want to highlight it is because you may recognize this person. This is a national podcast, the first episode of it. And this person had a big article come out in July. Many of you were contacting reporters as the Big Beautiful Bill, now known as HR1, was being passed to discuss the various impacts that you were worried about on Medicaid. And it's just a reminder that all of the work that you've kind of collectively done throughout the year builds on itself and sometimes gets revisited later. So if you want to check out this young woman from Racine and listen to what she had to say, now she has been, interviewed again. And I think the other thing worth highlighting here is that if you've had connections with reporters, first of all, you can reach back out to those connections, especially if it's been a few months, and say, hey, this is an ongoing story, or this is something that's changed for me, or here are some new worries based on more information. Because, sometimes reporters, they see a thing that happens at a moment in time, and it may be time to remind them that that thing that happened on July 4th is still here, and it's still, still causing impacts, and now we know more. So that, there's a way to keep that event newsworthy by reminding reporters that it isn't just done, it's now moving forward into another phase. The other thing that was a good reminder from this interview is that this person really said, hey, I never expected to be on Medicaid, but here we are for all of these reasons. And you could also be impacted by these changes because you may need something that isn't available at this point anywhere else but Medicaid. And I think it is useful. There have been, over the past year, some kind of some references to, you could be impacted too, but especially since the impacts on SNAP in the last few weeks, there are really quite a few people who don't quite realize the scope and scale of how many people rely on these various programs that are very familiar to us who work with people with disabilities and older adults, and especially people who are in lower income brackets or are restrained and forced to be low income because that is what the programs require, that you have to be poor enough in order to get into the program, especially Medicaid, home and community-based long-term care, to get the things that you need. And as I've been talking with legislators and others, this was the SNAP pieces in the shutdown. They did not realize how many people relied on small bits of money coming from the federal government to be able to reliably eat. And I think it is, somewhat a sign of success that the program has run smoothly enough where people have been able to rely on it. But it also has meant that a lot of the things that have been put in place to make sure that people have some access to food, have some access to medical care, are unseen by the decision makers who might be making changes to those programs. And many of the decision makers who are in Congress or in our state legislature are coming from a group of people who may not have any experience firsthand themselves with having to rely on programs that require poverty. So it was a really good illustration about, how many people rely on this kind of program that for most of the part has worked so well that folks is kind of humming underneath the system, and that so many of those people are working, was a real surprise to a lot of lawmakers. And there's two ways to think about that. Oh my goodness, there are so many people who rely on this program. There shouldn't be as many people in that program, is a reaction that I have heard. There's also the opportunity to say, correct, because and those so many people rely on this program because they are not earning enough to be able to pay all of their bills and still afford food. And I think it's really important to kind of steer how people who are making decisions about what should get funding or more support understand who is in the program and what happens if those things are disrupted. So Congress has done some things this week. We had a government shutdown, the longest government shutdown in history, just end this week. I believe Wednesday evening, the Senate passed a edited version of a continuing resolution, and the House then agreed to it, and the president signed it. So, as of 2 days ago, we have an agreement about reopening the federal government, and now a new deadline for when Congress has to get its business done, or we will be in the situation where we're considering whether or not there's another government shutdown. You can see that it will take some time to get things up and running again. So most watchers are expecting that even though the government has now formally reopened, it may take a few days for that to actually, for those gears to grind forward and things to start humming again. Remember, we've had a lot of federal employees who have been furloughed for more than a month. It doesn't mean that they weren't getting contacts and the work wasn't coming in. It just meant that they weren't there to kind of keep up with the work coming in. So even though agencies are reopening, it doesn't mean that they are able to deal with the backlog of things public servants are doing daily all at once. You can also see that Congress has a Thanksgiving break, and there's not a tremendous amount of time before the end of the year, really. Congress is scheduled to leave the December 19th. So there's a lot of things for Congress to do in the next 3 to 6 weeks that will determine what programs are funded and whether we are in a same situation again in January. So what is in the continuing resolution that passed? First of all, it sets a relatively short expiration date. And the way I would frame this is this is the next crisis point. Congress did not pass a full year budget bill for all things that federal agencies do. So for those agencies that do not have a permanent 2026 budget yet, this continuing resolution kind of keeps them funded the same as they have been until this new date. And if we get to January 30th, 2026, and Congress has not approved a 2026 budget for that agency, then either Congress has to pass another continuing resolution, or we are in the same situation where the government would shut down and that funding would expire. A couple of important points. January 30th, that is after December 31st, which is when the Affordable Care Act subsidies expire. And it is after the ACA Marketplace open enrollment period for 2026 closes. So this date means that if Congress does nothing, both the subsidies and so does open enrollment. The continuing resolution did fund some of the 12 appropriation bills that Congress has to pass every year for its permanent budget. So 3 out of the 12 spending bills were passed as part of the continuing resolution, which means that for agencies that were included under those 3 appropriation bills, they have funding through fiscal year 2026. The federal fiscal year runs from October 1st to September 31st. So for those 3 appropriation bills, all the agencies that are covered by them now have funding through October 1st, 2026. And they are agencies that were considered the easiest and already had kind of a negotiated plan that both parties agreed with in place. It only represents about 10% of the spending that is covered under the 12 appropriation bills. So it's kind of a small piece. One of the appropriation bills that was settled was the U.S. Department of Agriculture, which includes SNAP and school nutrition programs. So if we are in a position January 30th where another government shutdown is being considered, SNAP has been funded through October 1st, 2026. And that would not be something that we would see a repeat of, where SNAP funding would be delayed if there was another shutdown, because they have a permanent budget for 2026. Other elements of what was included in this continuing resolution, you might remember that October 10th, there were many federal employees that instead of being furloughed, which is a term that means you still have your job, but we're not paying you to do your job, and we're not expecting you to come in and work without pay. That for in a government shutdown, there are certain workers who get furloughed and certain workers that are required to report to work even if they're not being paid. The administration decided, instead of furloughing many employees, that they were going to use the shutdown as an opportunity to permanently fire about 4,200 employees. And that has been subject of ongoing court cases as to whether or not they were able to do that, if that was legal or not. But it has created a huge amount of confusion, and many of those employees were part of the U.S. Department of Education, and specifically on special education. So the continuing resolution says all of those people that were permanently fired by the administration on October 10th, regardless of how the court cases come out, they get their jobs back, and they have a guarantee they have those jobs through the deadline of the continuing resolution, so through January 30th. The continuing resolution also says all of the federal employees that missed their paychecks while the government was shut down, they get paid for that time. That has always been in previous shutdowns what has happened, that federal employees were kind of made whole by Congress after the fact. This time, the administration had publicly said several times that they were not interested in paying employees who had been who were furloughed during the shutdown. So this is language that says Congress is saying no, all the federal workers who were not paid during the shutdown must be paid. There is a federal law that already says that, but this is another statement that is reinforcing that that is an intention by Congress. The resolution says, hey, no more mass firings of federal workers until the continuing resolution expires January 30th. Okay. It does not, the continuing resolution does not extend the Affordable Care Act subsidies. And it doesn't include much language to prevent the White House bypassing Congress's spending instructions. The other element, again, not in the continuing resolution, is the Democrats got a promise that the Senate would vote on a bill of the Democrats choosing to extend the ACA subsidies in mid-December. So that is kind of what the agreement was to reopen the government. Now that we have a new deadline in place, we have kind of moved out onto the horizon. When is the next potential crisis point? And now the question becomes, what is Congress going to do between now and January 30th? There are 12 annual appropriation bills. It's about $1.8 trillion of spending for federal agencies to carry out federal law, run programs. The continuing resolution approved 3 of the 12 appropriation bills, but that means that Congress has major decisions about most of the federal agency spending, including pretty big ticket items like the military and healthcare spending. A couple of important points. The House and the Senate haven't agreed on the top line number they're willing to spend. And for some of you who have been following, what's been going on for the past year, you might remember in February and March, there was a big kind of conflict or argument about how much should the reconciliation bill that became H.R. 1 cut. This is a similar discussion. What is the total amount we are willing to spend? Is it the same as what we're spending now, higher or lower? And there are disagreements amongst Republican members, especially about how deeply to cut the current budget. So the continuing resolution keeps funding levels the same as they were last year. And as Congress talks about what they're doing in 2026, those spending levels could change. They could go up, they could stay the same, they could go down. We are actually spending the same amount as we did in March of 2024, because last fiscal year, 2025, Congress never passed a budget. They never passed a permanent budget. They simply extended continuing resolutions. And one reason that fiscal conservatives kind of like the idea of just extending continuing resolutions is it makes it much easier to keep spending the same amount instead of making spending increases. Sometimes there are programs that get the same amount of money. However, costs of running those programs have gone up. So the same amount of money doesn't buy you the same amount of service. So keeping the budget forever at the same funding level over time often means that the programs are able to do less if the costs have gone up. So we will be watching again to see, what is the number that they say we're willing to spend and whether that number is higher, the same, or lower than what is being spent now. And even if it's the same or higher, that doesn't mean Congress is going to fund every program the same way. Sometimes they might want to increase funding for some things, and that could mean decreasing funding for other things. The Senate is telegraphing it will be considering more funding bills, more permanent funding bills. Overall, that's a positive sign that they want to move and potentially approve permanent funding bills as opposed to just letting it sit and coming up to another continuing resolution. Both the labor, Health and Human Services and Education appropriation bill and the appropriation bill that covers housing and urban development are on the list of up to 5 regular appropriation bills that may be part of the next round of discussions. Now, if you're keeping track of math, we have 3 appropriation bills passed, up to 5 additional individual appropriation bills that might be working through the process. 3 plus 5 is 8. We have 12 appropriation bills. That still means there's 4 left that aren't being dealt with immediately. It remains to be seen if those remaining 4 bills will be worked on in advance and passed before the continuing resolution ends, or if they will simply use another continuing resolution for those agencies. So hopefully in the next week or 2, we will start seeing what the proposals are for the final, in a permanent budget for both of these areas. We did see in August that the House and the Senate had advanced I believe the Labor, Health and Human Services and Education budget through committee, and that most of the things that we were watching as disability advocates, especially the Department of Education and the disability and aging programs within HHS, Congress did not indicate in that committee work that there were any cuts or changes to how they were thinking the government should be organized there. But, we are now in a different moment. And just because the committee just makes some decisions, that is not the same as what the overall Senate votes to do. So what about those ACA marketplace subsidies? The expiration date in the law is still December 31st. We are now closer to December 31st than we were, and the continuing resolution does not do anything to extend those subsidies. Yes, the Democrats have been promised a vote on a bill to extend the subsidies, but the House has not committed to vote on a bill. And it is likely that any proposal the Democrats advance in the Senate is not going to be supported by their Republican colleagues, because the Democrats have a fairly strong position to just extend the subsidies as they are. And the Republican members have been consistent that they do not want to do that. So there will be a vote in the Senate. And it is likely that the Democrats' proposal will not have enough votes to pass. Even if it did pass, there is no commitment for the House to vote on whatever the Senate passes. And remember, both the House and the Senate have to agree before it can be sent to the president and signed into law or vetoed. There are many House members that do not want to extend the Affordable Care Act subsidies at all. And over the last few weeks, we've been continuing to cover that there are some Republicans that are willing to extend the subsidies, but don't think the subsidies have to look the same as they do now. And there's been a lot of discussion about how do we change who can get the subsidies, how much they're worth, and make other changes that might increase costs for people who have marketplace plans, like set minimum premiums, or in fact prevent some people from having subsidies at all, and people who have subsidies now continuing to have something similar. So there's the same kind of mix of ideas. Some senators seem to want to hold a vote on the Democrats' proposal and have their own proposal so that they can kind of highlight we're voting down what the Democrats say, but we're voting for, something that is related to the subsidies. There is not agreement on that. And if you want a real deep dive about, well, how could Congress get to a place where something happens, there's an article here you can read if you're looking for a little bit of hope on that. However, this week we've also heard something very different come up from the president himself, which is more in alignment with some of the House members who don't think who have never liked the Affordable Care Act and don't think they want to extend the ACA subsidies at all. So there is now some discussion of different ideas. The question is, if you let the subsidies expire, are you going to do anything else that you are going to try to convince people who have higher healthcare costs that you're doing something to reduce those costs? So a couple of ideas that have been floated this week is to get rid of the subsidies for everybody entirely. Like, don't do any subsidies at all. Not just, not continue them at the level that they are now, but just not do them for anyone. And instead, replace it with send federal money to individual people that they could use in a special kind of account. And there's actually two kinds of accounts that are being discussed. Health savings accounts are the main one, but there's also a different kind of account called a flexible spending account that has been talked about as well. And the difference between the two kinds of accounts is really what you can spend those dollars on. So the idea that seems to be talked about more is giving people a set amount of money into a health savings account, and then that account has kind of rules around it about what you can spend the money on. And it is restricted to spending money on health care stuff, whatever they define as falling into healthcare, you could use that money for. Flexible spending accounts are a little different in the sense that you can spend that money on a wider set of things, not only healthcare potentially. But I think there's more agreement that you want to give, if you're giving money for people to spend on healthcare, that you should put it in an account where that's the requirement. Now, this approach is kind of similar. If you remember talking about block grants, about with regard to Medicaid, this is kind of a mini form of that in some ways. People get a set amount of dollars to spend on healthcare. It is unclear if those dollars will reflect the actual person's healthcare needs, right? Because as we know, people with certain underlying conditions or disabilities or age factors have a different level of healthcare needs, perhaps, than younger people who do not have health problems. So there's not enough details about this plan to know that if the block of money you have is more, or if you have actual health conditions that need management, or if everybody gets the same amount of money. The amount of money somebody gets may or may not be enough to cover their health care needs, either purchasing insurance or paying deductibles or paying copays or paying out of pocket for things that are not covered. And that is how I think it's similar to like a mini block grant. You get a set amount of money and you can spend that money on certain things, but as the cost of those things continues to increase, that same amount of money buys you less care. So that is one proposal. There are a lot of folks, and we keep hearing this term of death spiral with the ACA. Remember, insurance works when you have a large number of people, and many of those people are younger and healthier and have less need for health care. The amount of premiums that many people who have lower health care needs pay in offsets and allows insurance companies to pay for the smaller number of people who have higher healthcare needs. So in general, in insurance, you want as many people to be insured, and that becomes your insurance pool. And you want as many people in that insurance pool to be younger and healthier and pay in premiums and pay in dollars that they will not be using on healthcare, so that you have overall enough money from all of those people to cover the cost of the care for the smaller number of people who do need healthcare. So a lot of times when we've been talking about the risk pool, the risk is about how likely is it that you as an individual will need health care that is going to cost more than the value of the premiums and copays and deductibles that you are paying in as part of your insurance plan. And people who are younger and healthier, the insurance company has less risk that those individuals will cost them more in terms of having to pay out for healthcare costs, right? So that's what we mean by the risk pool. And many of the changes that we've talked about, both from HR 1, but also some of these other ideas, the concern is that fewer people will be in the risk pool. People will decide to go uninsured or have lower cost plans. And when you have fewer overall people, that means there's less money coming in to cover everybody. So it's kind of concentrating those folks who have healthcare needs, because those are often the people who are most likely to really work hard to stay insured, because they know that they're going to need help paying those bills. And when you have lots of people who leave the insurance pool altogether, you end up with having more and more higher cost people. And as a result, the insurance company says we have to charge more for plans because we know that we have more people who are going to be using more healthcare. And the money that we are charging for premiums and copays and deductibles is how we make sure we have enough money to cover those insurance claims. This is an idea that experts worry will cause that kind of death spiral to happen, that you have many people who get money in an AC or HSA account, and then they say, well, I can't afford the plans that are being offered, so I'm either going to pick a lower cost plan, or I am going to go uninsured and hope that my HSA is enough to cover any care that I need. And for some people who are young and healthy and lucky is an important word here, that might be a financially advantageous strategy for a while. There's a different idea floating around as well that would not give federal money directly to individual people, but would rather pay federal money directly to insurance companies, with the idea that the insurance companies would pass along those savings to reduce individual people's cost sharing. You know, the amount of money that they have to pay for copays or deductibles when they use their health care. And that is kind of an old idea that's researched. These are not new ideas. These are old ideas that are resurfacing again. And some folks are actually talking about this is a repeal and replace of at least the subsidies. It's not a repeal and replace of the entire ACA, as has been tried in the past. And remember, the Affordable Care Act was really important to people with disabilities, older adults, for lots of reasons, not only cost, but to guarantee that insurance companies had to cover pre-existing conditions, for example, and certain kinds of preventative services. There were a lot of things that were not true before the ACA that are now, that really have set a base expectation of what insurance companies have to guarantee their policyholders will have some financial support to cover. This is not replacing the entire ACA, but it is an idea that would replace the subsidies that go currently to individual people to help cover the cost of their premiums. Meanwhile, on SNAP, if you have a crick in your neck because you have had trouble following all of the different developments of SNAP, you are not alone. Last week, a couple of courts, not just one, said to the administration, you need to fund all of the SNAP benefits that are owed people for November. Wisconsin was one of the states that acted immediately after that court ruling, I believe last Thursday evening, and said, okay, two courts have said you have to pay the full benefit. We are going to pull the levers and push the buttons that we need to do to make sure that money gets loaded onto individual EBT cards for food share participants. I think there were like 9 states that did that. Not all states did that. After Wisconsin had kind of pulled the lever, the administration decided it did not like that court's decision that said they had to pay full SNAP benefits, and they appealed. And they appealed to the Supreme Court, hoping that the Supreme Court would say, no, you don't have to pay full benefits, or at least delay the other court's rulings. So that would mean that benefits couldn't be paid out. Last Saturday, the administration also directed states to undo any actions that they took to fund SNAP payments. And they said, don't pay the full amount, you pay partial amount. And they threatened that states like Wisconsin that had acted to make sure people got their November money could face financial penalties. I will say that the administration has changed what it's telling states to do and not do on a nearly daily basis throughout this period. So first, the federal agency had said pay partial benefits. Then it said it would comply with the court order to pay full benefits. And then it changed its mind. So, Wisconsin acted after USDA said we will comply with the court order to pay full benefits. And then the administration changed its mind and appealed and told states to undo all of those things. So it's been very, very confusing. Not for food share benefits in Wisconsin, their money came onto their cards, but for folks who are trying to figure out what's happening, it has been difficult. Now we're in a place where the government shutdown has ended, and the federal appeals court kind of delayed its rulings because it looked like the government was going to be opening up, which would mean this argument about do we have to pay full or partial, or can we deny paying SNAP benefits at all during a shutdown would be moot if the government was open. And now we're in that position. And additionally, the new continuing resolution funds SNAP for the next 2 years. It funds SNAP through October 1st. This is confusing. It funds SNAP through the next fiscal year, but generally agencies that receive money have 2 years to spend it. So Congress included the 2026 USDA regular budget bill in its continuing resolution, which means they now have a block of money that is reserved for SNAP, and they have 2 years in which they can spend that money. The USDA has now said that when the government reopens, SNAP payments should resume within 24 hours for most states. 16 states, including Wisconsin, I guess it was more than 9, already released the full benefit amount. And there were another 13 that had done partial payments. So what we think that now that the government's reopened, this should remedy the conflict over what to do about November payments. And because the government is no longer shut down, we are not going to be in a conflict about whether or not December SNAP payments go out. However, in 21 states, there are people who haven't received their November SNAP benefits, and it may be a few days before the government reopens and that money gets drawn down to cards. In the middle of all of this, the administration also has talked about and been critical of the SNAP program. And it is hard to know exactly what specific reforms are being talked about here, but the rhetoric is important in the sense that, again, there isn't a lot of knowledge about who is actually using the program. And it's an important opportunity to keep reminding folks about who relies on these little bits of money to keep from going hungry. The president's remarks are really saying there's too many people on SNAP, and is making an implication that maybe there are people who are using SNAP that shouldn't be, or who are doing so fraudulently. That's kind of a theme that we have heard. There aren't any plans that they have talked about on what reforms to SNAP they might be referring to, but it's important to know that in the middle of all of this conflict about whether or not the administration wants to or has to pay SNAP benefits, there is certainly a decision maker who is being critical of the overall program and how many people are in it. And for those of you who have been following this issue, this is a program that's particularly important to people with disabilities, and especially people with intellectual and developmental disabilities. Again, in SNAP, almost 2/3 of the people who receive food assistance, households who receive food assistance, are also in Medicaid. And for people with intellectual and developmental disabilities, they are often in Medicaid because Medicaid is the only place that offers the health and home and community-based long-term care that they need. They can't get it anywhere else. So for many of these folks, they have to meet the income and the asset limits, and that also means they are qualified for other programs that are reserved for poor people, because you have to be poor to qualify for Medicaid. And if you're poor and you qualify for Medicaid, you probably are poor enough to qualify for food share and other programs. So, when they looked at how many households that receive SNAP have a person with a disability in it, it's really high. It's about 20%. And it's a lot harder for many people with IDD to access benefits, and many folks don't have as big of a social support network. So this particular moment where those benefits were interrupted had a much higher and disproportionate impact on some of the people who really rely on it the most. So, you might say, what can we ask Congress to do? And I think we are now in a place where Congress has ended the government shutdown, but still has a lot of business to do that's really important. And it's, you as a constituent can start asking questions, because now Congress is in a place where it not only can act on different things, but it needs to. So if you are a person who's concerned about whether or not there will be ACA subsidies and what they will look like, here's a series of 4 questions. The big question is, do you support extending the subsidies? And there's a secondary question if the answer is yes, maybe, or no. Other questions are related to, what are you doing about fully funding the programs that are important to people with disabilities and older adults? So are you going to pass all of the regular appropriation bills? Are you at least going to pass, the labor, health and human services, and education budget? And what's it going to look like? What's going to be in it? How much are you going to keep the levels of funding the same or increase them for programs we care about? Are you going to make changes to where certain programs are located. These are all relevant questions, and they're really coming from, conversations that have been happening since May, and for a lot of programs people are concerned about. The same questions about if you pass a permanent budget, are you expecting the administration to spend the money like you said, Congress? And how are you going to guarantee that? Very relevant question. And what are you going to do if the administration isn't spending money as you directed? Those are important questions to keep asking at this moment. So meanwhile, the administration is continuing to do its own things. There are lots of things the administration can do without Congress. There are also things it's doing that most legal scholars say it should be doing only with Congress's permission. And one of the questions that we have continually heard is, again, causing chaos and confusion. We had the entire Office of Special Education, almost, and the Office of Civil Rights in the Department of Education. Most of those federal workers were fired October 10th. Now they've been unfired by Congress, but only unfired until January 30th. And then it's unclear about whether or not those positions will come back. And it's also unclear whether this order to unfire these people will actually mean they come back into the office or the agency to do work in that time between now and January 30th. So just as a reminder, almost everybody, 121 out of 135 employees for the Office of Special Education and Rehab Services were fired. They eliminated the entire section on October 10th. They also fired an additional 137 workers in the Office of Civil Rights. And those are the people where that parents go to when they have exhausted their ability to work within their own state to resolve discrimination cases when it comes to, is the IDEA being implemented properly. So it's kind of the last stop for parents across the country when, IDEA is being violated and the school district, and in some cases the state, has not done anything, not done enough or anything to make sure that student's right to an education is being fulfilled. That is on top of almost 300 workers that were fired in the same civil rights section in March. I think that, and again, this shows you there's still a lawsuit that is ongoing about whether or not those 299 people who were fired in March should have been fired. That tells you kind of how long these court cases can go on to kind of deliberate and determine whether that action in a moment in time, which was now many months ago, was legal or not. What happened with those 299 people is I think 247 of them are on paid administrative leave. In other words, while the court case is determining whether or not they should have been fired at all, the Department of Education has not, in fact, called them back to do the work. They have said, okay, your job is on hold and we will use this different category to put you on administrative leave. So we're not firing you, but you're also not doing any work. In January 2025, the Office of Civil Rights had 600 staff. They have lost almost half, in March. And now, if you could take the two actions together, only 62 of their current 446 employees are not fired. So that's, when you think about going from 600 to 62, That is like 10% of the staff that we had making sure states were compliant with IDEA are left. And there is question from national advocates about what does the continuing resolution that passed Wednesday actually mean for these workers. They are being returned to employment status, which means you're not fired. But it is not clear that there's any protections to not refire those people when the CR expires at January 30th. We also have a 2026 appropriations bill, right, for the Department of Education. We don't know exactly how that's going to look, if the full Senate will make changes that are and House changes that are different. That has been an item of concern, right? Like if Congress starts changing and agrees with the cuts that the administration has already tried to make in that appropriation bill, then it seems pretty likely that after January 30th, you would see Congress kind of blessing this plan and this idea to dramatically reduce the Department of Education and perhaps even eliminate it and move pieces of it elsewhere. That has been kind of the ongoing fear really since May, and what people have been watching as the president's budget proposal and other language has come out in the press. It is also unclear whether those workers who were fired October 10th and now have been restored to an employment status are going to come back and resume work now. Or are they going to be put on administrative leave, as has happened to many of the workers that were fired in March from the Office of Civil Rights? Both these functions, the Office of Civil Rights and the Office of Special Education and Rehabilitative Services, are mandated by federal law. So all of the actions that have occurred here have been done at staff, at staff that is required, at least under current IDEA. And the conversation about, is the Department of Education going to exist or going to be eliminated, and what parts would be moved where, continues to be out there in the open. There is no formal plan that is out there that people can point to, although this was a proposal in Project 2025, and the president's budget that he released in May also made reference to moving parts of what is now the Department of Education elsewhere. So it isn't just an unfounded fear that advocates have, but there is no formal plan on a website that I can link to that says here is what the plan is. Already national advocates are worried enough where they have been talking for months and have are now talking more and more about the risks, especially to students with disabilities, of carrying out the plan, any plan that would move those special education functions to agencies that weren't the Department of Education. And I think a lot of folks are looking at both what the president's May budget and what Project 2025 said as kind of, guideposts for what that plan could be. The administration is insisting that any changes aren't going to impact or interfere with services being provided to students with disabilities. However, there has been a couple of points in time where the federal oversight staff that is making sure students with disabilities have their rights to the free and appropriate public education honored, those are being dismantled. There's clearly an intent there, at least from advocates' perspective, and impacts that come from that. It is, the plan that has been kind of proposed by Project 2025 and the president's proposal would have special education being moved to the U.S. Department of Health and Human Services as a potential agency that could do oversight of special education. Note that they're not moving the expertise in the staff necessarily over to a new agency, especially if there has been now repeated attempts to eliminate those positions within the current Department of Education. And many national advocates are pointing out that it doesn't make a lot of sense to house special education in an agency that is primarily concerned about health. And there's a lot of concern that that may return or continue, so depending on your viewpoint, that people with disabilities are viewed solely through their medical conditions as opposed to learning potential. Another move that there is a plan here, and we talked about it a few weeks ago. The Department of Housing and Urban Development manages housing assistance and also grants that are given out to various local agencies to help prevent homelessness. The administration has actually a lot of powers that don't necessarily need congressional approval, and this is an example of one of them. So there is a grant program called the Continuum of Care that has a amount of money, $3.5 billion, and it's the main source of federal money for homelessness. Congress may choose to keep the level of funding the same, and maybe the program, in statute and all of those things stay the same. But the administration has quite a bit of ability to decide how to award out that money in grants. Some of you may be professionals who have applied for a grant before, and so that every time there is a grant opportunity, there's an application. And usually that application is very clear about who can apply, like what kinds of criteria do you have to meet in order to be able to apply. And those grant applications often also define not only who can apply, but what the money can be used for and what it can't be used for. So changing the application on a grant can really change who can get the funding and how it can be used. And apparently, HUD is we're anticipating that they are in fact changing that grant award criteria in a way that will significantly change how this program works. This continuum of care funds, everybody served by it are people with disabilities because that's one of the requirements of the program. And a lot of them are on the older end. The changes that are proposed are going to cut funding for permanent housing by 2/3. And that could mean that there are lots of people whose housing is being covered by these permanent housing funds that are about to be reduced. That means that people who rely on those funding are at risk of becoming homeless as soon as January. It's about 170,000 people, advocates are worried, could be almost immediately affected by that proposed change. 30% of the money is going to be shifted into temporary programs, not permanent housing programs. And that's important for two reasons. One, you're shifting a lot more money into a temporary solution that is time limited for people who may or may not be in a position 2 years from now to be able to afford housing. And the second reason it's important is that those short-term programs are also going to be implementing a lot of rules that might make it harder for people to get or stay in the program and receive that temporary assistance. And it also looks like there are some policy changes on how that money can be used that are in alignment with some of the executive orders and other activities that the administration has been promoting. including dismantling money for law enforcement to dismantle homeless encampments and to force people to accept treatment for mental health or addiction. The other piece of this that is different is it will give the federal government a lot more power to decide where the money goes and doesn't go, not only where, but to whom. The current program gives out funding to lots of different local groups, and there's a requirement that all of those local groups are guaranteed to receive about 90% of what they received the year before. The reason for doing that is because lots of these local groups are nonprofits who need to have some guarantee that they will have money to continue the next year and be stable. This is kind of operating revenue, so to speak. Most of that money is going to renew existing programs across the country, and it has been typically for permanent housing. We've had a housing first approach for many years now, and the idea behind that is that homeless people, the first thing they need to do on their path to stability is to have a stable place to live. And then there may be other issues when you have that stable place to live that can be addressed. And that could include addiction or mental health, but it also could include things like, how do we get you stabilized and in a particular place so that you can look for a job, or other things that come with not having to move around and having no place to live. So the new plan says, well, all of you organizations that have been getting 90% of what you got the year before, we're going to reduce that to 30%, which gives them a pretty big cap in a very short amount of time to fill, and a lot of uncertainty. Maybe they get 90% like they did the year before, or maybe they get 30%. And the federal government may decide to pick winners and losers. If they know that a local group needs the 90% and they don't give them that, that is putting that local group in a position of potentially not being able to continue business. And what it means is that there could be lots of money that gets kind of thrown into a competitive pool, and it would make it a lot easier for the federal government to reward and fund certain grantees, or move larger amounts of money to certain parts of the country and not others. And as part of this, there are also some provisions that put groups that have had DEI, diversity, equity, and inclusion, as part of their grant applications in previous years at a real disadvantage for receiving money in this current grant cycle. And for many of those organizations, DEI was part of the requirements of previous grant cycles. In other words, the application required people to explain what they were doing on DEI, like a couple years, last year and the years before. So it essentially says that anybody who received grants before who complied with the grant application is now potentially at a disadvantage for receiving future funding. In addition, there was, and this is coming from the State Department, new guidance, and we think that this guidance is kind of being released before a rule that was in place in the first Trump administration is being reinstated. A memo went out to employees who are in charge of deciding who can come in to the country and stay, that says, hey, if people who want to come into the country and stay have certain kinds of medical conditions, you shouldn't let them come in. Age is one of the criteria. So if you are too old, and it doesn't say a number, but being older is now a reason that you could be denied entry into the country. And the reason that they are using to say there are certain kinds of health conditions or ages that we should not let into the country is this idea that people who are older or who have certain medical conditions or disabilities might be more likely to use health care or use long-term care. The public charge is the words that they use to describe people who might rely on government programs in order to cover health or long-term care costs. So it's an idea that is rooted in, are you going to become somebody who uses more money than we will get from you? Some of the medical conditions that are also being flagged as reasons to not let people into the country are pretty common. I have them listed here, but anybody who is, managing diabetes or mental health is specifically called out. There's a whole list of health conditions that this memo is saying, hey, these things can require a lot of expensive health care. So we should make sure that people who are trying to come into the country to live don't have these things because we don't want those bills. Oh, even conditions that aren't necessarily related to immediate health, but might contribute to health conditions down the road or not for certain individuals, like obesity, are being flagged as a reason to not let people in. And they're specifically saying, hey, long-term care is expensive, so we don't want people who could, be in a long-term care setting because of their health conditions coming in. More alarming, I guess, is that there is an effort to assess also not only people's age, health, and disability conditions, but whether or not they can pay for treatment without any help from the government, without any, ACA insurance or Medicaid or Medicare. Very much trying to make sure that people are, if they have insurance, it's private insurance, or they can privately pay for their care, and they will not be using any program that is touched by public dollars. And the guidance also, it's not only about the individual applying to come in. People can be denied based on the health of their other family members, including children or older parents. So specifically, this memo is saying, hey, look out for disabilities in the family. Look out for chronic medical conditions or other special needs, and deny them entry to the country if you see those things. Because we're worried that if this person comes into the country and they lose their job, that their family members could also become people who might need help from a program that has public funds. This memo is actually familiar. The public charge rule from the first Trump administration, kind of made that a rule. And it was scrapped in 2022, but the intent of the rule was to make sure that immigrants who used public health insurance programs they were legally entitled to use, would not want to come here. So there is a draft proposal that we are aware of this rule coming back, and it was sent to the White House on Monday. That's usually the first final step before it's published, before public comment. The previous version, and maybe it's different this time around than others, I think we have a pretty clear sense based on the memo that was sent to State Department employees about what what the intent is here. The previous version of that rule was to help deny applications for permanent residence status if they were expected to receive food or housing assistance, Medicaid, or other public benefits. A lot of immigrant groups are particularly concerned that this may have a real impact on refugee populations, especially. Last time this rule was in place was the first time that Medicaid had been put in that category of public charge. So it does seem like it's pretty comprehensive. Other things that the administration is doing and is being reported on now is really related to these administrative powers. Most of, the ability to change grant criteria can have a really big impact, right? We just talked about that. The ability to change administrative rules can really have a big impact on how things are implemented. And this other outstanding issue of, is the administration going to continue to ignore the specifics on what Congress says it has to spend money on, is unknown. So there have been lots of examples in the previous 10 months about decisions the administration has made that have either slowed funding going to places or stopped funding for programs that, and this article was specifically focused on health programs, but as reporting or other requirements or applications change, there's a lot of ability to slow down or stop funding, not because Congress has said that this is not something we don't want to spend money on, but because the administration has a lot of flexibility changing the rules that can affect who applies and what kinds of projects that they are ultimately deciding to fund or not fund. There is a theme, and we saw it with the SNAP appeals. Last week we talked about a federal judge saying to the administration that you do need to provide American Sign Language interpretation, at least at press briefings. The Biden administration had done that, and that stopped in January. And the judge ruled that not doing so was actually a violation of the 1973 Rehabilitation Services Act. Well, the Justice Department is appealing that ruling and wants the next judge to say, hey, we want to make the requirement for when we have to do sign language interpretation as limited and narrow as possible. And we want to make sure that we don't have to do sign language interpretation at a whole host of different kinds of events. We only want to, if we have to do it, we only want to do it for the narrowest possible set of circumstances. There is a pattern, and we kind of have talked about it at least 3 times in this presentation, where there is a court ruling and almost immediately there is an appeal process. We've had firings that happened in March where there's a court process that's still ongoing. We had a SNAP ruling that seemed fairly clear and an appeal. Here was a ruling that seemed fairly clear and now an appeal. And that is a strategy to kind of to delay implementation of what the original judge said should happen, right? And also create some chaos and some time and distance between the event that happens and when somebody determines whether it's legal or not, or tries to say you cannot do it this way, you have to do it another way. Another court case that the Supreme Court has decided to take that may impact people with disabilities is related to voting, and specifically, when can mail-in ballots be counted? If they arrive after Election Day, about 30 states, I think Wisconsin included, give a grace period where if your ballot is postmarked before or on election day and it doesn't get there by election day, it's still clear what your intent to vote was. You still did what you needed to do to get it to the clerk that counts the ballots. And simply because the mail delivery was late shouldn't be a reason to discount your ballot. That is the logic behind why you might have ballots arriving, after election day. And why many states have said, we need to build in some time, because we know there are delays beyond a voter's control that do not impact their intent to vote or when they voted, but might impact when the ballot got there. A lot of military voters, when you think about people overseas, and there's lots of populations of people where they may put in their ballot and it may take quite a bit of time before it gets to the clerks. So the Supreme Court is hearing a case that is challenging whether or not ballots that were received after election day should be counted at all. The states are arguing, hey, election day means when voters have to make a choice. It doesn't say when ballots must arrive. But if the court sees that differently, it could mean that lots of people who are using mail-in voting need to now make sure that their ballot would arrive by election day. And that would be a very different scenario, and potentially mean that there would be a lot of voters who have done all of the right things to vote, but by virtue of their ballot not being delivered at the right time, would not have their vote count. So the impacts of the reconciliation bill, or HR 1, that was decided or signed into law July 4th, are continuing. And here is another kind of underreported impact of that bill. HR 1, yes, made huge cuts to Medicaid, but it also made some changes to how the Affordable Care Act worked, including making sure that hundreds of thousands of legal immigrants aren't eligible for the Affordable Care Act subsidies anymore. And that means that there are many, many people who are here legally, who are part of that large insurance pool and have been paying premiums and copays and deductibles, who all of a sudden aren't eligible for any subsidies. And we kind of talked about this earlier in the presentation of what would the impact be if if the subsidies were changed, if they went away for some people, or if we switched to a different thing that might not provide enough money for people to cover the costs of their health care. So this particular change essentially puts that into practice for a group of people who are currently in the Affordable Care Act marketplace insurance pool, helping cover the cost of everybody who's using those plans. The Congressional Budget Office believes that about 300,000 people will end up not having any coverage at all, and will be removed from that group of people who's paying in to help pay for the coverage for everybody, because they can't afford plans without subsidies. In addition, there are lots of families where there may be one person who is the insurance holder, who is the plan person, but there may be a person who's a legal immigrant, and children who are citizens, and perhaps spouses are a citizen. A lot of folks are saying the impact might be bigger, because entire families could lose their access to the insurance plan, either because there's nobody else in the family who has, employer-sponsored insurance or a different path to go, or because, you have 300,000 policy holders that might disappear from the pool, but those policy holders might have other people who are relying on that policy to provide coverage, including families and children. They're also saying, when you remove people from the pool, that means insurance prices rise for everyone. And demographically, immigrants tend to be younger and they tend to use fewer health services. So we are potentially people who are leaving the insurance pool are the people who are paying premiums and not using healthcare, which means what they're paying is helping everybody else, all of the citizens who have ACA health plans, stay insured and lower their costs. Another, this is a provider-oriented group, has put out a report. It's kind of a national survey, primarily of providers of intellectual and developmental disability services across the country. And they are very clearly saying that not only are in-home supports the most likely services that are going to be cut, but the continuing workforce crisis and the funding cuts that are on the horizon and that states are now starting to consider in advance of implementing HR1 are a real factor in provider agencies deciding what they are or aren't going to offer. And you can see that it's pretty, according to the survey, at least coming from providers, there are lots of providers that are saying we're going to make cuts if we can't recruit and hire the staff that we need. We've been in a caregiver shortage for a long time. They're low paid, they don't have enough benefits. And now we're in a place where, there are immigration policies that are impacting that workforce as well. About a third of the caregiver workforce are immigrants. So we've kind of got a bunch of things that were problems before, and now new reasons why there are fewer people who might be coming into that workforce. And if it doesn't get better, which it has not for years, more than half of the providers are going to be looking at scaling back their programs in order to fit the number of staff that they have. And that means that there will be less capacity to serve the number of people who need help. They're also reporting that providers have already cut programs, and where they're cutting is in the services that help keep people in their homes. I guess this is kind of a validation of some of the things that you have been saying since February were going to happen. Doesn't feel particularly good to be right in this case, but this is an article that is saying, hey, we were in a place before $1 trillion worth of Medicaid cuts were put into, happened, where we needed investment in this area to make sure that the people who need help to stay in their homes could have it. And while the HR1 doesn't specifically say which programs should be cut, it leaves that up to states. Disability advocates have been very clear that the things most at risk are the things that are optional under Medicaid law and that are most expensive to provide. And that is home and community-based services. Another article, this time from Colorado. You may remember in August, after HR1 occurred, Colorado was in a specifically unique position because a lot of their state budget is actually tied to federal tax law. And so they had an immediate budget problem once HR1 was passed that they needed to address. And they made Medicaid cuts at that time. They made other cuts as well, but they made some pretty significant Medicaid cuts to make up for that instant budget shortfall that was caused by HR 1. Now, and the governor at the time said, this is the first round of cuts. We know we're going to have to do more cuts. Here's the next round of cuts. They are now in the process of doing their state budget, and it looks like they are not going to provide all of the money that is needed to keep doing all the things they're doing in their Medicaid program the same. That cost to continue. You might remember Wisconsin, that got their budget signed just before the reconciliation bill happened, did say we are going to spend more money for Medicaid to make sure we can continue doing what we are doing right now for the next 2 years. We have a 2-year budget. Colorado is not doing that. North Carolina also didn't do that. So they are essentially cutting what their program is doing by virtue of providing less money than the actual cost of what they're providing now. And it's a more than $300 million cut. Part of where they're cutting is the payments to family caregivers who are specifically caring for children with and adult children with severe developmental disabilities. And they could be cutting how much those family caregivers are paid by up to 10%. Some states have decided that a response to the lack of paid caregivers is to pay family members who are often leaving the workforce and providing lots of unpaid care anyway, that it is a good investment to pay those family members to do what they can't hire anybody else to do because there's no place to hire. Not every state has those policies, but some do, and Colorado is one of them. Importantly, as a total amount of what Colorado spends its state budget on, Medicaid is probably the biggest thing that they spend their money on. 30% of Colorado's budget is Medicaid. And community care costs are where the most cost is and where the most increase of cost is. So it is logical for states that have really significant budget holes to look at the biggest things that you spend money on. Family caregivers who might be the people who are going to get paid less are being very clear that the amount of money that the state thinks it's going to save by paying family caregivers for a really relatively small number of people is not worth it. It isn't enough. It isn't a lot of money. And the risk of paying those family caregivers less, especially as they're aging, is that family caregivers won't be able to make it. They won't be able to have enough money to be able to provide the care that is needed, and that will force some really hard choices for families, including whether or not they have to send the person that they are successfully caring for at home and are happy to provide care for into an institution. And you can see the difference in the rates of how much it costs to keep somebody in an institution in Colorado. That is a figure that is in line with many other states as well. So the family caregivers are being very clear, like the amount of investment that you make paying family caregivers is a savings of thousands of dollars a day for in terms of what it would cost if this person would be in an institution. The other important thing to note in this article is that other policy changes that are part of this package that are designed to reduce costs are going to impact the same group of people. So many states have a wait list to get into um, any kind of long-term care program. In Colorado, it's about 8 years long. You have to wait 8 years. You're eligible to be in Medicaid and get home and community-based care, but there's no space or money for you, so you have to wait until somebody else opens up a spot. And you wait 8 years in that state. Um, there was a policy that said there's a certain group of people who always needs care and has been part of the children's long-term care program. They don't have to wait because we know they need care. That is another policy that Colorado is considering ending, which would mean for parents who have kids that have pretty high support needs that have been supported in the children's waiver, when they turn 18, it looks like they get to go in the same line that everybody else does. And of course, if you have high care needs that family caregivers can't provide as they're waiting, that really does open up the risk for institutional care. And family caregivers are also saying, and it also doesn't exist. There isn't a group home. There isn't a place that family members can go, which is also shows us the lack of, provider capacity. And we just had an article about providers saying, hey, all of these budget and Medicaid cuts are having us think that we're going to reduce the amount of care that we can provide. So it really is kind of a vicious cycle here, and it really does look like it's impacting the people with the highest care needs the most. This is a very budget wonky paper, but you can read it for yourself if you want. I think the main point here is that most states are worried about having to make Medicaid cuts. They are looking at the overall health of the economy, how much tax revenue is coming in, as well as the costs going up for the things they're doing now, as well as cuts in the future needing to be implemented. And those three things are making it pretty likely that the Medicaid budget they have now will not be enough to keep doing the same level of services for the same groups of people as states are doing now. That will mean cuts, essentially. And we've seen several states that are already implementing cuts. I think that we will continue to see that trend by more and more states, especially in their next state budget cycles. Some states have annual budget cycles. Some states, like Wisconsin, have 2-year budget cycles. But as we go forward, the advocacy that people with disabilities and older adults have had at the federal level is going to need to shift to the state level, because these are the people who are deciding, how are they going to cut a budget and where are they going to make cuts. And as we talked about with SNAP, most of the decision makers aren't really going to be aware of where is the best, like how important these programs are, and what happens when they aren't able to provide the services people need. What happens to those people? And that's going to be a real need, I think, over the next year for advocates to focus on, is to kind of re-demonstrate why these things are important and what they enable people with disabilities and families to be able to do and contribute to states' economy. Otherwise, you may have players who are really advocating for their own, part of the pie, but that may not be helpful to individual people who, are trying to make sure that they have the right services in place to avoid an institution. And lastly, again, another theme, we've talked about the $50 billion rural healthcare fund that was included as part of HR 1. The deadline for states to apply was last week. Every state applied, including ours, and the Department of Health and Human Services has a ton of discretion about where that $50 billion gets distributed. There is a certain guarantee that every state with an approved application, so we don't know, there might be states that don't have an application that is approved, but every state with an approved application gets a set amount of money, that half of that $50 million goes to states who have an approved application. But the rest of it really can be awarded, you know, not equally across states. And the applications also are not for things that help offset the operating revenue losses that many rural clinics will face with Medicaid cuts and or fewer people having insurance if that in fact comes to pass, with people deciding not to stay in the ACA marketplace exchanges and go uninsured. And a quarter of the total money will go to states that score well on initiatives and policies that the administration is kind of highlighting as things they like. One of those policies that they like is prohibiting what people, saying what people who rely on SNAP can and can't buy. And there are several states that have passed laws or asked for waivers from USDA to restrict what people in SNAP can and can't buy. Those states obviously are meeting that policy initiative that is kind of a plus in the grant application. Previous to this administration, that was not allowed. States were not allowed to say you can buy some things but not others if you are a person on SNAP. So just again, another place where there's a lot of ability for the administration to make very different decisions that can really make a difference about how much money flows to places and where that money flows. And that is this week.
Thanks, Tammy. I think all of the questions were answered in the chat.